Good morning, everyone. This is Morgan Cook with Positively Osceola here for Positively Osceola's Daybreak Live. Happy Monday to you guys. It is June 7th, 9 a.m. right here on Positively Osceola. So excited to have you guys joining us this morning. We are very, very excited for today's special guest. We have Dr. Christian Rosado with Orlando Health joining us today. Very excited that he's taken time out of his busy schedule to discuss some very important topics. As everyone knows, the past year has been a very challenging being in the pandemic with COVID-19. And Dr. Rosado has all the questions that have been brought in to us by our viewers to get those answers about COVID-19. So be sure to give this video a big thumbs up. Make sure you comment below and let me see who we have with us. And then also hit the share button again. Lots of important information that we are going to be discussing this morning. So would love to have you guys do those three things. I'm going to come on here as well and hit the share button. So that way everyone has all the topics and the discussions that we're going to be talking about today. Like I mentioned, I hope you guys are having a wonderful Monday. Hopefully you've had a great weekend and you're excited for a new work week. So excited to be here with you guys this morning on our morning segment. I went ahead and grabbed me some Monday go-go juice, some coffee to get us started this morning. So go ahead and grab you some as well. It's going to be a great interview and we're excited to have Dr. Rosado with us. So without further ado, we will go ahead and get started this morning with our Daybreak Live here on Positively Osceola. All right, so this morning we are very excited to welcome our special guest. That is Dr. Christian Rosado. He is a board-certified neurohospitalist with Orlando Health Neuroscience and Rehabilitation Group Neurology Group. He provides swift and time-sensitive care to patients who develop unexpected, complex neurological conditions while in the hospital. Examples include stroke, intracranial pressure, neuromuscular emergencies, and extended seizures. Dr. Rosado also is available to consult with medical staff regarding the care, comfort, and safety of inpatients with neurological conditions such as Alzheimer's disease, Parkinson's disease, myasthenia gravis, and amyotrophic lateral sclerosis, and more commonly known as ALS or Lou Gehrig's disease. So we're very excited at this time to welcome Dr. Christian Rosado with us this morning. Hello, Dr. Rosado. How are you doing this morning?
Good morning, Morgan. I'm doing fantastic. Thank you for having me. Really much an honor and a pleasure to be able to speak with you this morning.
Awesome. Thank you so much. I know you have a busy schedule. Things are always crazy over in the field that you come from. So thank you so much for taking time out of your busy schedule to join us here on Positively Osceola for our Daybreak Live. So we're going to go ahead and just jump right into it. We're going to be discussing COVID-19 in the past year with the pandemic. You know, it has been a challenging year and there's lots of questions out there. But to go ahead and get into the questions that, you know, people are eager to know. So recently, the recent Lancet Psychiatry Journal examined over 200,000 COVID-19 patients. And according to that study, roughly 1 in 3 were found to have neurological or psychological conditions within 6 months of being infected by COVID-19. So is this something that came as a surprise to you, or was the data that you may have been looking at already shown this to be true?
Yeah, Morgan, yeah, it was really a landmark or a really eye-opening study, and it was an interesting study because it was such a large amount of people, and it really it did include a large amount of people in the United States, and a lot of the studies prior to that were really from Europe and other countries, and so this was really eye-opening for all of us. Looking back at the whole time period where we all have been learning, and for us physicians caring for people with COVID, I can say that we definitely knew that there were neuropsychiatric symptoms occurring. Mm-hmm. In the hospital, it's something that we saw pretty much on a day-to-day basis, and then even as time went on, starting to see those symptoms in the outpatient and in our clinics as well. So I don't think so. there wasn't a surprise that we saw that there was a link to long haul neuropsychiatric symptoms. But what I can say was extremely strongly surprising was the amount. And I don't think any of us really realized the actual, the depth of the amount of patients that were found to be suffering these conditions, because it was frankly just a huge amount. They found that about a third of people with COVID-19 had some form of long-term neuropsychiatric symptom. That's something that none of us were expecting.
Right, for sure. Now, what type of conditions or even symptoms are you seeing that the community should be aware of?
Absolutely. So it is a wide variety. And I would say that, really we can, the way that we view it is we kind of, split it up into what we're seeing in the hospital and symptoms that are sort of more acute and dangerous. And then symptoms that, while they're still very, very important, they may not be as acute, may not lead to hospitalization, but are more long-term and causing more serious symptoms that way. The acute symptoms that we're seeing, unfortunately, are things like strokes, and that's probably the most serious one that we are seeing. The paper quoted that about 2% of people did have strokes associated with COVID-19, and that unfortunately it was correlated with how ill they were with COVID-19. Those that had what's called serious COVID-19 or severe COVID-19, which meant that they had factors like longer hospitalization, more need for oxygen, God forbid, even needing to be on a ventilator or in the intensive care unit. They actually had rates of stroke as high as 7%, which is really striking when talking about such a potentially tragic and life-threatening condition. So we have seen, unfortunately, people suffering from strokes associated with COVID-19. We've also seen other acute neurological and psychiatric conditions like seizures, something called encephalopathy, which is when people are very sleepy and confused. And then also even cases of psychosis, actually, but this would all fall within the setting of hospital settings. Outside of the hospital, more long-term, we've seen what's been found to be more common. So all those things I mentioned before, while they're very important and they're definitely very serious, luckily they're more rare when it comes to looking at the overall the COVID, people with COVID. What we see more commonly are things like more psychological. So that would include anxiety, and actually in this paper, they showed that up to almost 20% of people who have survived and recovered COVID-19 had some form of serious anxiety condition. Frequently, that could be manifested by insomnia, or at least along with insomnia, also depression, and then also an increased use of substances such as alcohol or other recreational drugs. There was really high rates of those seen long-term as well. I can also mention that there were more neurological symptoms that were seen long-term, but they weren't as in high numbers as psychological. That includes headaches, memory loss, impairment with balance and coordination. All the things that are seen long-term as well. Probably the most well-known neurological symptom at this point, so well-known that it even made its way into the CDC criteria, actually is the loss of taste and smell, which we're all familiar with, can be an early sign of COVID-19. We definitely have seen a lot of that. And again, while not necessarily dangerous, I can tell you I have many patients with those symptoms, and they're not pleasant long-term.
Right. Oh, I can imagine. Absolutely. Now, with COVID-19, we've heard of the category, the long hauler. What are you encouraging patients that have been infected by COVID-19 that may fall into that category, especially if they are experiencing the symptoms or conditions as you've described?
Right. I strongly encourage that anybody with those symptoms to not wait to seek help. Any signs of psychological, like symptoms, which could be feeling sad, not really having the same enthusiasm for day-to-day activities, not feeling the same enjoyment in things that used to be enjoyed, or feeling symptoms of anxiety. So that could be having feelings of fear or panic or nervousness or not being able to sleep. And if in people that have had COVID-19, I don't encourage to wait to see if those would go away or get better. But we're seeing in a lot of people that they don't. And the important thing to mention is that these are treatable or manageable conditions that people with COVID-19 or who survive COVID-19 that have these symptoms, you do not have to live with feelings of anxiety or sadness. And if you seek medical help early, the chances of beating those symptoms is much higher as well. The other thing I would mention is just to have a general sense of awareness, and not just for individuals who have survived COVID-19, but also for family members or friends, and really be on the lookout, looking for also more serious signs that could be signs of dangerous acute medical conditions. So signs and symptoms of strokes. I could tell more about that, or any other medical condition. But the main thing is don't wait to seek help. The conditions are treatable, and the earlier the better.
Absolutely. Now, going off of that, has there been any data regarding long haulers? Are those experiencing neurological conditions as far as age or gender, or maybe pre-existing conditions possibly causing the previously infected patient to not recover more quickly and potentially fall into the longer haul category?
Yes, there's a suggestion. Like a lot of things with COVID-19, there's still a lot that we're learning. And as every few months goes by, we get better clarity on, what is the long-term trajectory and how is this all going to play out in everybody. But it is very clear, though, that there are people that appear to be predisposed to having some of these symptoms, or at least it's suggestive. And the predisposing facts or conditions, they really are the ones that we're all very familiar with. So those of us that have conditions like hypertension, diabetes, high cholesterol, people who use tobacco products and smoke cigarettes, people that already have known to have cardiac disease, or God forbid have had strokes or heart attacks in the past. And then also people that have already do suffer, or they have suffered in the past from depression or anxiety. We know that all of those folks are at higher risk of developing these symptoms or having them be worse following a COVID-19 infection, and potentially for lasting longer after the infection as well.
Absolutely. Now, if someone believes that they might fall into that long hauler category, or they might be experiencing, those conditions of the neurological or psychological conditions we've discussed today, what do you recommend they do if they're watching right now and maybe they're thinking, that's me? What do you recommend to them?
I would recommend to talk with family and loved ones, definitely as a first step, those immediately available to us, and really start a dialogue, start a conversation, and not keep these things in, and then, but really, the immediate next step, or really at the same time, would be to talk to your trusted healthcare provider. And it can be anybody. You don't necessarily need to seek out a neurologist or a psychologist, or any of those types of specialty physicians or providers. Talking with your primary care doctor is a fantastic first step, or even talking with a mental health counselor or a behavioral health specialist. Really, any healthcare provider, just to start the dialogue, start the discussion, and really guide next steps would be my initial advice. And then I know that with those initial steps, anybody with these symptoms or feelings, can quickly get guided to the care that they need.
Absolutely. Well, thank you so much again, Dr. Christian Rosado, board certified neurohospitalist with Orlando Health Neuroscience and Rehabilitation Group, Neurology Group. Thank you so much for your dedication and your time to this past pandemic and all the efforts you've been bringing to your patients. It does not go unnoticed, and we thank you so much for your time today. If you're joining and you would like more information about Orlando Health, just visit orlandohealth.com. And remember, there are 2 locations: Orlando Health location right here in Osceola County, the Orlando Health St. Cloud Hospital, and Orlando Health Emergency Room and Medical Pavilion, Osceola, which is located right off of the Osceola Parkway. And to Orlando Health is nearing the completion of Orlando Health Emergency Room and Medical Pavilion, Randall Park, a 15-acre campus at the northeast corner of Dowden Road and Randall Park Boulevard. So lots of exciting news coming for Orlando Health. Thank you again, Dr. Rosado, for being here with us today. We really appreciate your time. To go ahead and sign off this morning, this is Morgan Cook with Positively Osceola here with Dr. Rosado with Orlando Health, and together we're